Hi and welcome to this video on how to massage your caesarean section scar. I'm Fiona Dolan. I'm a massage therapist and the business owner of EMR Wellbeing here in Lower Hutt. Also on today's video will be Linda Lovett of Puff Fitness, who will show you the many layers that are incised during this very deep surgery. Before I go ahead and demonstrate the techniques, it may have been many years since you've delivered your child via caesarean section, so go ahead and try these techniques. The benefits are fantastic. Also, if you have recently given birth to your child via caesarean section, please wait at least 6 weeks until that scar side has started to heal and that there is no infection and that you have been given the all clear by your midwife or your obstetrician or your GP. It may have been more than 6 weeks since you've delivered your child via C-section, and that site area may still be sore. It's still okay to go ahead and try these techniques. Use as much pressure as you feel comfortable. There may be a little bit of a burning sensation, but that's okay. But if it really is too uncomfortable, do stop, as you don't want your body to tighten up and fight against you. Scar tissue is the body's natural healing process, so think of it as scaffolding that is supporting the healing of all the layers that have been incised, and over time that scaffolding needs to be taken down. So that's where caesarean section scar massage can help you. These type of techniques can be done now and forever. So if you ever find that your caesarean section scar site starts to tighten up, use these techniques. It may be once a month, it may be every 6 months, it could be every year, and so on. But if this is new to you and you want to get started, please don't hesitate to give me a call if you're based here in Lower Hutt or Wellington, and I can help you get started and teach you how to use these techniques. So I look forward to hearing from you, and thank you for watching this video. Bye. Hi and welcome to this video of showing you how you can massage your own caesarean section scar. Please just check with your midwife or your GP to make sure that the scar is healing and that there is no infection. So if you have just recently given birth via a C-section delivery, you're looking at probably 6 weeks before you can do this. If you're not comfortable with touching the scar, it's okay just to bring your hands to the area here and then just visualize and acknowledge that this is the way in which you delivered your baby. Sometimes this is all it needs to take for you to be able to then touch and then massage your scar. If the scar itself is still a bit sore, you can start massaging up and down above the scar, up and down, and just feeling how it feels underneath. Okay, up and down. We're just working the skin layer at the moment, so you are putting a little bit of effort and pressure in there, but if it is uncomfortable, then you're stopping. Okay, and you can feel if there's any resistance in that skin layer. And if you find some resistance, then just push into that area, hold until it melts away. And then you can do that below the scar, up and down, up and down, up and down. And if there's any resistance, move in towards the area of resistance. Then you can take circles and below the scar, and then if you are comfortable, you can work directly on top of the scar, moving that scar around, circular motion. And then if you can pick your scar up and then roll, picking the scar up and rolling it, picking the scar up and rolling, picking the scar up and rolling. We're just working the skin area at the moment, and that's all that you might be able to do. You can do that 5 minutes a day if you want to, and then when you're feeling it's released or through the skin area or the superficial area, then you can start going deeper. It's the same technique. It's up and down, up and down, up and down, up and down. Finding the areas where there is the resistance, working deeper. So yes, you've got pressure in there, but if it's uncomfortable, let go, taking it into the area of resistance, holding it, waiting for it to melt, then let go. Circular motions, working deeper. So this time we're working the muscle layer. Circular motions. If you're comfortable, working on the scar, going deeper in. I should say at this stage you don't use any massage balm or oil because we need to be able to get further into the abdominal cavity. We don't need to slip. Okay, and then if there's the area of resistance, take it into that resistance, waiting for it to melt, and then we can let go. To get further into the layer of the organs, you can bend your knees. This is allowing your hands to sink deeper into the deeper into the organ area or the organ layer. Doing the same thing. So we're sinking in a bit further, up and down. Sinking in, up and down. Sinking in, up and down. Feeling where there's some resistance is, taking it towards the resistance and holding. And then let go. And then circular motions. So we're still working above and below the scar, or you can work directly onto the scar, taking it right into the abdominal cavity, pushing down, only to where it's comfortable for you, and massaging. So this is something that you can do, like I said before, 5 minutes a day, every day, and then you might, when you get used to the layers of tissue releasing, you might take that out to once a month, and then you might need to check in maybe every 6 months or every year, just to make sure that the tissues are still being or still are loose, so that you get a great freedom around through the pelvic area.
Hi, I'm Linda. I'm the owner of Puff Fitness. I'm a registered nurse and registered exercise professional. I've been training women who are pregnant and postnatal for over 10 years now. Today I want to talk to you about postnatal recovery following cesarean section and some of the exercise considerations related to that. And I'll also show you this chart which demonstrates the surgery around cesarean section and all the layers that are incised during the operation. So when you've had a cesarean section, before you return to exercise, the most important thing is that you've checked in with your midwife or your obstetrician to check that you're safe to exercise. Some of the considerations that we have as exercise professionals who use my postnatal recovery program are that your scar should be healed and infection free, and you should have stopped bleeding vaginally as well. So in terms of exercise, it's okay to start walking around the house in the weeks before the 6-week period, mobilising around the house, and also you may be getting out to the mailbox. It's important to know how to lift your baby, especially as your baby gets heavier, and we cover that in my postnatal recovery program. It's also important to know how to protect your tummy when you are passing a motion, or when you're lifting a heavy thing as well. This is because of your scar tissue and also because of your abdominal wall may be weakened from pregnancy, and your pelvic floor muscle function will be affected as a result of pregnancy and because of the deep nature of the surgery. So the exercise prescription starts off in our classes with breathing. So we monitor your breathing to make sure that you're breathing okay, because your breathing is part of your core and that can be altered when you've been pregnant. The other thing is to notice how your core is functioning, so the rest of your core, deep abdominal muscles and also your pelvic floor muscle, to see that that's all working well, because that's your deep core that's been affected from pregnancy and birthing, and that has to be strong before you start to lift heavy things or do impact exercise. I just want to go through now this chart I've got here, which is the anatomy of cesarean section, and it just shows you the deep nature of the surgery, because often as mums we sort of see our cesarean section scar and we think that it's healed, and often it has, but the full healing of cesarean sections can take up to about 2 years, and that's because the nature of the surgery is so deep. So I'll explain this now. So you can see in this chart I've got here before me, we've got the skin layer, and then that's inside. You can see the little incision here, and often the scar is a little bit longer than this, the skin, and then we've got beneath that the fat layer, and we've got the layer of the fascia, the connective tissue, the abdominal muscle, and you can see at this point in time the incision is often done vertically, so that the incisions in the surgical approach does vary per surgeon, but this is one of the most common approaches. And then we've got the peritoneum, the line to the abdominal cavity, which again the incision here is vertical. And you can see we finally get through the pelvic organs deep into the body, where we have the bladder sitting in the front and the uterus is behind, and at this point in time the incision is made horizontally. And then we get into the amniotic sac and the incision there, and then finally we get to the baby who is deep within our tummy. So all of those layers have to get stitched up again, and there's 7 layers that have been incised, and that's why you saw, post having the operation, and all the layers that are incised and then resutured makes for a lot of density of scar tissue and adhesion formation throughout the scar. So that's why it's important to go and have a massage by someone like Fiona, who is a qualified massage therapist trained in C-section scar tissue release, and just to have that all freed up as the adhesions are laying down, because that helps to improve blood supply and also helps to make you move better, so you don't have pulling sensations around your scar. So I hope you enjoyed this video, and I look forward to seeing you and meeting you personally. I've got a studio here in Seatoon and Puff Studios, but I also have trainers throughout the country who are using my postnatal recovery program to help to recover women from childbirth. So you can get in touch via my website. Thanks for listening. See ya. Bye.